So thank you for the invitation that allowed me to be here today so I can share with you the work we have been doing in the Caribbean for the last 2.5 years. How many of you have visited the Caribbean? Let me see hands. Most of you, okay. Do you have an idea how many Americans go every year to the Caribbean islands? Give me a number. Around 20 million. Yes, so around 8% or so of the population every year go to the Caribbean, to one of the big Caribbean islands, either Jamaica, Dominican Republic, Belize, even though it's not an island, is considered part of the CARICOM. This is the Caribbean economical systems that they have together. So what I'm going to be talking today is a little bit how this project happens to be, some of the technical missions. So I'm going to walk you through the process on how we put this system in place and share with you some of the preliminary results we have about antimicrobial resistance out there. So the first step was about antimicrobial use and antimicrobial resistance. As you know, the emergence of antimicrobial is obvious out there. And the way how we're going with some of the pathogens, we're going to run out of antibiotics in the next 20 to 30 years. 25 to 30% of those multidrug-resistant cases normally tends to be associated with zoonotic pathogens that can be associated to the agricultural production side. So that part of the pie is something that is our responsibility. All of this started with this, what they call the Caribbean Week in Agriculture. They do it once a year in the Caribbean country, and they move that around, and normally it's attended by the ministers of agriculture and the CBOs, the chief veterinary officers of different countries. And they met there, and in 2014, we make it as a part of a team to talk about antimicrobial resistance and the problems that this is creating and what we foresee in the future coming in. And then at that time, the Minister of Agriculture of Guyana, one of the largest countries in the Caribbean, approached the Animal Health Director for the Inter-American Institute for Cooperation in Agriculture, ICA, to ask, okay, we need to train our personnel because really we don't have the human resources and the capacity to really see what is going on in our countries. And that's how they approach us here at Ohio State, and they request to produce some kind of a training on antimicrobial use and antimicrobial resistance related to agriculture. So we put a 2-week training program for public health professionals. So we brought people from the Ministry of Health, the Ministry of Agriculture, and in some countries from the ministry that have to deal with food safety issues. So sometimes they divide it in that. So we brought these key professionals from all these different organizations to Columbus, Ohio, and trained them for a period of 2 weeks. So we have a total of 33 participants representing the largest countries around the Caribbean area. We also have a couple of observers from Venezuela and Colombia that are also part of the Caribbean basin. And they came to Columbus, Ohio to be trained. What do we train them about it? So the first week, it was very focused on very specific points associated with antimicrobial resistance. So day number 1 was completely focused on acquired resistance, all the biologies, all the concepts, framing the problem currently today, the difficulty to identify how much antimicrobials we use in agriculture, and all those kind of issues. Then the second day was focused on specific food animal production systems. So we go into poultry and swine and beef and dairy and aquaculture, how we use antibiotics, with the problems we have in measuring that, and antimicrobial resistance and the different pathogens that are creating headaches out there. The third day of the program was mostly focused on the monitoring, the surveillance program themselves, all the different elements that take place of that, how they work together, the problems and realities on how to monitor these two issues. And the fourth day was to focus on the morning, was mostly in the diagnostic part, all the different tools that support the surveillance and monitoring programs, and in the afternoon was the outreach component, which, as we heard before, is extremely important when you're responding to these kind of problems. Through the 4 days, then we had representatives from the CDC NARMS and USDA NAMS program, the National Animal Health Monitoring Program. We have FSIS representatives that also got involved in this surveillance program, as well as the FDA. So basically they heard all the federal programs that are currently in place, and not only how they work today, because for some of these countries it's kind of 30 years, away. We talk about how this program is started, okay? And the last day, we turned the tables around and we asked the representatives from the different countries to tell us what kind of monitoring programs do they have in place. And the surprise was that by the end of the presentation of these 15 countries that participated, they have none. There was not any information, data, not at all about how much antimicrobials do they use in their animals, neither what kind of antimicrobial resistance, if any, was circulating in the most important food animal production systems out there. Then the second week, we switch around the gears. As one of the biggest frustrations for me when I do this kind of a training program is that you bring all these professionals, all these public health or agriculture officials, you provide them the tools, you motivate them, and then you send back home with nothing to do. That was not the case. So when we were working with the European Union, that was the main financial sponsor of this through the SPS agreement and the NIAA, I told them that I want to make the second week no more training. It was more, let's put plans, something concrete that when they go back to the countries that can, generate data and really start the process. And it's basically training on the job. And that's what we did. So the second week, we went around and we went to the Animal Disease Diagnostic Laboratory here for the Ohio Department of Agriculture, the Consumer Protection Labs, that is the Food Safety Laboratory for the state, the Ohio Department of Health. So we went through all the different regulatory agencies in the states that have to deal with antimicrobial use and antimicrobial resistance in agriculture, so they can hear from them how these programs work today, but even more important, how they started, 20, 30 years ago. And then the last 2 days of the week, basically, we work with the country representatives to put these pilot projects together and give them very specific tasks so they can go back to the country highly motivated and be able to do so. So how we put it together. So the whole idea of this training was to end with a couple of pilot projects, and we call it the CISARA project, basically that they can really start to collect information and start these monitoring programs in place. For that purpose, we use the guidelines provided by the World Health Organization. They already put a roadmap in there that tell countries or states how you put these surveillance and monitoring programs in place for antimicrobial resistance, specifically antimicrobial resistance. And this is put together by the AGISAR group. This is the advisory group on integrated surveillance on antimicrobial resistance. And it's a roadmap. It's basically like a recipe. If you follow that step by step, by the end of that, you have a monitoring system in place. And that's exactly what we did. And let me give you a couple of examples. The first question they have there is, select your target population. So we asked them, what is the most common food animal production system that produce the protein source for your countries? And there was a discussion out there. So it's either poultry or beef or sheep or goat and different aquaculture, seafood. And at the end of the conversation was poultry by far. Okay, so it's the number one protein source for the people living in the Caribbean area. And when you see the numbers, basically around 70 to 80% of the food source that they consume is poultry. For me, it was a surprise. Again, my bias at that time, I thought it was going to be, seafood. And the answer is not. They don't like seafood. As a matter of fact, it's a challenge to find seafood as a regular citizen in those countries, because seafood goes to the resorts, to the hotels, to the cruise ships, to the airplanes, because they pay more for that the local people will be able to afford, which was a big surprise for me. But at the end of the day, poultry was the number one that we agree through all the members to start the cycle of monitoring, because you have to go through beef and pork and all the different products. We also find out that it's consumed by basically all demographics and all socioeconomic status, and so definitely it was a very ideal product to start this monitoring program for antimicrobial resistance. Now, the next decision was, okay, who was going to be participating out of these pilots? Because we have 20-plus countries in the Caribbean, but not all of them produce poultry. So we set a bar and we say, okay, anybody that produces 70% of their own national production or their national consumption, they will be the ones participating in the pilot project, because that allows us to see what really is going on in the area. And because of that, then we end with 7 countries that you can see here on the screen that are part of the CARICOM group. And these are countries that produce 70% of the poultry they consume. And Well, if you go into the poultry industry, the next question is, where do you sample? Because it's extremely complex. You can go all the way from the eggs that they import, okay, through the feed supply, water, workers, environment. It is a lot of things that you can sample. But what we did is we used a kind of a HACCP approach, and we decided to identify critical control points in the chain that allow us to find out very cheap and quick what really is going on. So we choose 2 points out there. The first one is the pre-slaughter. So instead of us going to the farms to see what really is out there because of the biosecurity issue, we prefer that it came to us. So we wait in the slaughter plants, and as the chicken arrive, we collect sickle samples from those guys. And the next one is, okay, what is going to the consumer? So we went to the stores and buy the finished product that was being displayed for the consumer to take home. So these were our 2 critical points. Whatever we find here in the salmonella in regards to antimicrobial resistance, then it definitely came from the farm or the chickens or the eggs that were imported into the country. Anything we find here was introduced during the commercialization chain. The next things that Aguisar guy have, okay, what is choose your pathogen? So there was a big discussion between the participants in the countries and say, okay, E. coli, some of them were dealing with some Campylobacter issues, so they wanted to be Campylobacters, others were talking about Salmonella. And then after some discussion, we decided the Salmonella was the ideal one to be able to use as a target pathogen, at least as the initial steps in phase 1 of this monitoring program. And the reason for that is very simple. It's one of the top 3 foodborne pathogens in the area, so there's a public health benefit of that. Also, Salmonella can become a veterinary issue, an animal health issue, and it's an extremely good marker for antimicrobial resistance. So if some genes for resistance is circulating in E. coli or other gram-negative bacteria, Salmonella will take it even temporarily, but they're going to be able to catch it, use it, and when there is no more selective pressure, they throw it out. So it's a very good pathogen to look for resistance, because if you find it in there, it means that it's circulating in that population. And the key things that we used through all the time was to be simple but scalable, because some of these countries wanted to come and do like the U.S., beef, pork, and everything at the same time. E. coli, Campylobacter, Listeria, all at the same time. You say, do you have the money? I will design it for you, but you will need, I don't know, $10 million or something like that to launch the whole thing all at the same time. And that's when they realized that, no, of course, we cannot afford that, we cannot do that. And also is the lab capacity. How many people do you have in the lab? So in those countries, they have 2 microbiologists. Well, good luck in trying to keep all the sporting and regulatory things, and on top of that, put these monitoring programs in place. You cannot do it. So start with 1 commodity, 1 pathogen, and then next year you go to the next commodity, the same pathogen, and then after you cycle 5 years and you get more money or more interest, then you start to add pathogens or commodities into the system. And that's where we are today. Simple but scalable. The design was very straightforward. We had the 2 pilots, and look, we applied the same standards that we apply here into the United States. We look into sickle samples and raw chicken parts. The big difference from the U.S. and us was another surprise for me, because what is the raw part that we sample for Salmonella in the United States from chicken? Chicken breast, right? Because this is the most common consumed cuts that we like in the United States. In the Caribbean, quarter leg. Big discussion, hours just to make the decision. And the problem is quarter leg have a lower sensitivity, and that's the reason why we test the breast, because you have a higher presence of Salmonella in there. So you're looking for Salmonella, you want to look for that particular part. But it's true, over 70% or more of the people in the Caribbean, we prefer to consume quarter legs than chicken breast. And there is another important reason for that, is the economical component. Chicken breast is quite expensive because, again, they are competing against the resorts and competing against the hotels and what they call it, the kitchen air, the basically airplanes and stuff like that, that they pay a premium for chicken breast because that's what you want to eat in the airplane or whether you want to eat in the cruise. Instead, it's so expensive for them that they prefer to buy the quarter leg. So historically, that's the type of cuts you normally go. If you go to Kentucky Fried Chicken or one of these chicken franchise, you're not going to see the chicken breast or the chicken fingers. It's the quarter leg in all the promotional material. So, okay, fine, we go through that one. We decided only to focus on licensed commercial slaughter plants, and the same thing for retails, because as you know, they can sell it on the streets or have these backyard chicken production systems, so it's very difficult because they can be there today but not tomorrow. So you cannot set a monitoring system with those guys in place, at least not for the first step. The sample size, we decided to do regional. So the approach was regional. Instead of trying to design sample size by country based on production, it's just the region. So assuming like we do in the United States, we did the same thing. We just going through that, and then you look in divided. The other difference is instead of weighting based on production for the different countries, we decided to make everybody the same. Because one of the big concerns of the country is, well, for example, Jamaica is one of the largest producers. So even if we're trying to make everything anonymous for the confidentiality issue, if you see the largest sample size with this percentage of salmonella, you basically will say, well, this has to be Jamaica and this has to be Dominican Republic, and you will second guess more or less who they are. So we decided to make it really anonymous, and we sample everybody the same, even though we know we're losing a little bit of sensitivity. But at the end of the day, this is not about the prevalence of salmonella, it's about how much multi-drug resistance is out there. That's our target. Okay, so once we designed the plan, they went back to their countries with their plans designed by them using these international guidelines and the US guidelines. And the next step was to do these technical missions. So I went to each one of these countries to visit their veterinary diagnostic laboratories, to visit the food safety laboratories, and also their human laboratories in some of the countries, because it depends how they are regulatorily organized, looking into their capacity, the training of the personnel. All of them, at the end of the day, process already salmonella somewhere, somehow, and they have the minimum basic equipment for us to apply the FSIS FDA rules for salmonella. So that was great. So we moved along into that. The next thing, as I was in the countries, was to do these antimicrobial resistant talks, because remember, we only trained 30-something people, but there still were a lot of other public health officials and veterinary officials that they were not aware of the big problems of antimicrobial resistance. So we had these talks in these 7 countries. We also met with the poultry producers, mostly the associations of the industry representatives, to let them know why we were starting with poultry, because they felt that we were targeting them, and it just happened that you are the most consumably protein source, and so we need to start somewhere, and of course it has to be you. In all the countries, they unanimously support us to do this. So we never, once we explained the reasoning and all the logic behind, they went forward and they opened the doors for us, and we have full support. So over 100 participants were trained in these trainings. Most of them were public health officials or people from the industry. Okay, once we have a buy-in from everybody and they have the capacity, the next step for us was, okay, let's standardize the whole process, they harmonize. So we create standard operation procedure based on what the reality is. If you go into US DA or FSIS regulations or FDA, so you start your original sample at 45 centigrades, and then you go to 37, and then you go to 42, and then different kind of things. Some countries, they only have one incubator. So you cannot be going 42, 37, and 35, neither like that, because they have all the other regulatory stuff that they need to do. So we harmonize the protocol based on what their reality it is today. And so that's what we did. So we create these standard operation procedures based on what they have. Again, going back to all these laboratories. So what we did is we create customized field sampling protocols and customized laboratory protocols for them using the FSIS and FDA regulations as our baseline. And so we created step-by-steps all the process in the labs as well in the field, so they knew exactly how to do it, so we can harmonize across all the countries in the Caribbean. We also created customized epidemiological surveys, so we can collect data both at the pre-slaughter component side as well as the retail stores, looking for trends or risk factors or things like that. Of course, when you have the protocols, the next step is you have to train the people on them, because they were not familiar. Some of them have no background in this area. So we did a lot of webinar trainings. I cannot travel all the time because that's not my main job. My main job is to be the director of the Veterinary Public Health Program here at Ohio State. I have 55 graduate students. We have the second largest veterinary public health program in the United States, and that keeps me busy. So how I did it? Electronically. From my office, I connected to that, and we trained the people. have different groups to train. So we have a field inspectors or food safety inspectors. So we train kind of the main lead people of each one of those divisions and units, and then they took the responsibility to pass along to the next level in their countries, all the way from field sampling using the FSIS protocols. Also, then we train the laboratory people, and in some particular countries, we did some demonstrations in the lab to make sure that they were able to do it, because surprisingly, there was not antimicrobial susceptibility testing done in any of the veterinary or food safety laboratories across the Caribbean. So they only reached to the bacteria point, they call it E. coli, Salmonella, Campylobacter, whatever you want, Staph aureus, and that was it. They didn't have the capacity to do any antimicrobial testing. Then we also created what we call field teams. They have worked extremely well for us. Basically, we get graduate students and young professionals from Ohio State, and we train them in the way how we want in these particular protocols here in Ohio, and then we send them to the different countries. So imagine yourself in college or in veterinary school, and a professor approaches you and say, do you want to spend 6 to 8 weeks, all expenses paid in Barbados? You will work from 9 a.m. in the morning to 3, maybe 2:30 p.m. in the afternoon, and the rest of the time is yours. What would you say to that? Okay. I thought it was going to be flooded, so I put, picket line and, electric fences, because I thought I wanted to have a tsunami of students. And it was a very difficult time for me to recruit people to go 2 months, all expenses paid, to Paradise. And then I find out that a lot of people get married or have family vacations or they have other activities in the summer, and they're not willing to sacrifice 2 months of their private life to science, okay? But at the end of the day, it worked out very well. So we have, this is our field team, and they show to them in place how we want this to occur, and then they supervise the people doing that kind of things, and they help all the way from the sample collection and the slaughter plants to the retail store. So it was kind of a training inside. We also helped to improve the next generation, because the field teams were composed by 1 young professional from us and 2 young professionals from their countries that were not part of the government, trying to keep that next generation going on out there. We centralize all the logistics here in Columbus, Ohio. So one of the big problems that we have with these countries is that the procurement part is extremely difficult. So I centralize everything in my lab. So I bought everything, and we prepared the shipment. So it was designed in a way that these boxes arrive, and you open it, and you have everything from the gloves that you will need to get the cecal samples, all the way to the vials that you will need to send the samples back to us here in Ohio, and anything in between. Everything was pre-labeled, harmonized with the protocol, so they only have to open it and see how the things work and just follow step by step from the beginning to end. Then we ship it to them, and voila. Everything was designed to start in May of 2015, so we sent all the supplies and the field teams, and once they were in location, in June 1st, we started sampling in different countries. And by October of 2016, all the pilots were completed. So all the countries followed. Some of them have some kind of problems. For example, we find out that in Dominican Republic, the food safety inspectors couldn't get into the slaughter plants because there was not a law that allowed them to do so. They were only allowed to go if there was an outbreak or something bad, and this was not something bad, it's just surveillance. So through this, we identified a lot of gaps in the different countries in regards to their legislation or regulations, that some of them were as old as 1960 or 1958 about food safety regulations. So imagine that 40, 50 years ahead, they're definitely behind, and we find some of those gaps through that. They happily did their phenotyping in countries. This is the antimicrobial susceptibility testing. Then we obtained CDC permits to bring all these isolates to the United States so we can keep moving along for that. So these are some of the preliminary results. As you can see, all the countries fulfilled their part of the bargain. And the prevalence, as you can see, at the farm level is very similar that you will see in the U.S. and Europe and some countries in Latin America. The same thing when we go to the stores, very similar prevalence of what we see here, around 25, 30% or so at the retail level. What is interesting is in all the countries, this was the prevalence at the farm And this was the prevalence at the retail store, sometimes 2, 3 times, and in one country 4 times higher than it was coming from the farm. So what does that tell you? That somewhere in the processing of that product, in the commercialization, salmonella is getting into the system. The producers were very happy with that information because normally when you find salmonella in the end product, what do you think? The farmers. The commercialization, industrial farming, and all kind of stuff. And then when they find out that, oh, it's not us, not only that, we find out that the serogroups change. So we have Kentucky or some others coming into that, but the ones that were at the retail store were not the same ones coming into here, which were the ones showing up in the human side of the monitoring program. So there is a very interesting data that's coming out of this one. This is one of the main accomplishments for that. As I mentioned before, they didn't have any antimicrobial susceptibility testing at all in the islands, at least in the veterinary side and the food safety side. Now they do. So we provide the basic equipment, we train the people, and they did all of that. We're in the process right now in certifying what they did there. And these are the results for the antimicrobial resistance. Again, we're still in progress, and we'll tell you why we're in that. But this is a message to take home. We found no multi-drug resistant salmonella in any one of the country. We found probably no more than 10 isolates that they were resistant to 2, 3 classes of antimicrobials, which is no surprise for salmonella. But for the largest majority, over 90% of them, they were pan-susceptible. So you can pick any antibiotic and treat them, and it will do the work. They were very happy with this information, which is a little bit of disconnection because in the human side, they have multi-resistant strains, so it's coming from somewhere, but definitely apparently not from the national production system. This is where we are today. They are sending the isolates here to Columbus, Ohio to do the MICs, the minimum inhibitory concentrations. We just want to certify what they did in the labs is correct, so we can help them to adjust that. In an agreement with the Ohio Department of Agriculture, the Animal Disease Diagnostic Lab, we're going to do whole genome sequencing, and you know how good is that. It will answer a lot of questions in there. Going to be in the Caribbean this summer in the different countries helping to analyze the epidemiological data with their epidemiological teams. And then we're going to have workshops to see, okay, how we go to the next step. And we're going to prepare reports at the country level so they know based on the surveys what is going on in there. But then at the regional, it's going to be de-identified, so we only want to know what is going on, big picture. And, of course, we're going to upload everything in WhoNet. Long term, we're going to probably target some studies. We already started to work with Barbados and others that we found that discrepancy between the farm and what the people is buying at the store, and they want to know where it's coming from somewhere in the chain. So we already put a plan together for them. And the other one is trying to target the next commodities. The CBOs are very interested in imported poultry products. They want to know if this is coming to them because, as I said, their human cases have multiple resistance, but we cannot see it in the national production. And the other thing is we're trying to use the NAMs as a model. They don't have the money, the capacity to sample every year like we do pork and beef and poultry and multiple pathogens. So the idea that we are selling to them is just go and cycle that every 5 years or so, come and get. Antimicrobial resistance is a big public health or veterinary issue, but it's not like a tsunami that is violent and quick. It's more like lava from a volcano. It's destructive, but goes really slow, so it gives you time to see what is going on. And that's what we're selling to them. What do you think was the most valuable asset during all these 2.5 or something years? The veterinary students. Yes, interestingly enough, there is only 2 veterinary schools in the whole Caribbean. One is in Trinidad and the other one is in Cuba. And I was incredibly surprised. The majority of veterinarians that I work, they got the degree in Cuba. And they speak extremely good Spanish, which was an advantage for me because I don't know if you noticed, I have a little bit of a deep southern accent, really south. I'm originally from Venezuela, okay, so really definitely south. And I was surprised because in many situations, at least in the social part, they talk to me in Spanish, even though all of these are English-speaking islands, okay? With the exception of Dominican Republic, most of the Caribbean is either English, Dutch, or something they call papiamento, which is a combination of the 3 languages all together. Trying to figure out that one, and I don't even try. So the most important valuable asset for that was people. It was surprising because you normally focus very much on equipment and the labs and stuff like that, but we work with hundreds of these individuals across the countries, directly or indirectly, in the training and preparation, to show that they're able to do it themselves. They thought that this multi-drug resistant surveillance is, a multi-beheaded monster, and when they realized that, but it's just salmonella, put it here, and we do that, and then phenotyping, and voila, we have it. Oh, we thought it was more complicated. At the end of the day, we train over 230 public and animal health professionals on antimicrobial resistance. We generate kind of job in the training, but at the same time now we have preliminary data from the Caribbean. And on the top of that, we consolidated the in-country diagnostics. It was surprising for me that in many countries, the director of the veterinary lab sat for the first time ever with the director of the human health lab. They have not met each other in person ever. And they have been in the job, one was 13 years and the other one 20 years. So think about that. What is the likelihood here in Ohio that the Ohio Department of Health director have never met with the director of the Animal Disease Diagnostic Lab in the agricultural side? It will not, we don't phantom. In there was the first time, oh, nice to meet you, I have to see your name in emails and stuff like that, but it's the first time ever. So we're very glad that we were able to bring that together, and now they're sharing a little bit more information than it was before. And the final thought is this. A lot of the participants, of the officials, indicated that they felt empowered through the process. And this is one of the quotes that provides to us in the evaluation, say, this project made us feel better professionals as we're having an impact not only on public health, but also protecting our families. Because they realize that, man, this is what my wife buys. This is the supermarket I go every day to buy the food for my kids, and I cannot kid him that, yes, he was protecting his family by doing so. Before I go to my final slide, I have a captive audience, so I want to advertise a little bit one of the other projects we have. I don't know if you have heard about our Farm to Table program. This is a partnership between the University of Minnesota and Ohio State University. This is going to be our 10th edition. Normally we take professionals from the U.S. and many other countries, and we go to a country in Latin America mostly that produce products of food animal origin that are exported to the United States, and trying to understand how these global food production systems work. And so this year we're going to have it in Chile, with the week from November 12th to the 17th. And the way how we do it is we arrive there on Sunday, and then on Monday we hop into a bus and we go through all the different food production systems from farm to table. So we take beef, we go to a cow farm, then we go to a beef feedlot, slaughter plant, diagnostic, regulatory laboratories, regulatory personnel, sporting agencies, all the way to the grill to have a little bit of Chilean wine that is really, really bad. You don't want to try. Okay? In these programs, these are some of the areas. Of course, global food safety is the main focus for us, how they apply the U.S. regulations in their respective countries. This is a dilemma all the time, that this is what the European wants, this is what the American wants, this is what Japanese wants, this is what the Russians wants, and how they manage all of that together. Understand the food production systems and the dynamics in the respective countries. So you can compare, like Costa Rica, for example, is more tropical, and Uruguay trying to do this natural grass-fed beef, all the way to transboundary animal diseases, and of course the public health side. There are programmed activities through the whole week to be sure that the people work as international teams when they do these technical missions, so they can develop also soft skills. The message is, if you have young professionals in your organization that still don't have this international global exposure, this is a great way to do it. Every year we have people from USDA, the military, different kind of industry, from 3Ms to Kroger's and others, that send individuals with us so they can have this exposure. Normally, again, mid-level or younger professionals in your organization, they're looking to understand how these global food production systems work. As I mentioned before, we are in our 10th edition. We have gone through Uruguay, we have gone through Costa Rica, the central part of Chile, which is quite different from the southern part of Chile. We did that, the southern one, in 2015, and was heavily focused on the salmon production systems. So we went all the way to the breeding farms, to hop into a boat and go all the way to the cages in the sea and understand how the process, how they deal with fleas and all kind of stuff out there. Last year was Costa Rica. We even have gone to Thailand a couple of times. And this year is going to be in November in Chile. So you're more than welcome to join us or send somebody from your organization.